name's Michelle Jones. I'm with the city's Public Health Department, Maternal and Child Health Division, and I'm here with Rosary Muñoz from the Valley Regional Medical Center, and we're going to talk about some gestational diabetes issues.
Hi, my name is Rosary Muñoz, and I am from Valley Regional at the Diabetes Center. And our program is free of service for all the people here in the Valley, and we do get patients like from Harlingen. So we offer free education on diabetes. We offer free meal planning, and we do education on diabetes itself and insulin teaching. We do also help with gestational diabetics, and we do work with obese children. Okay, and our services are free. So at the end, there's a slide with our phone number.
What are some of the things we need to know about gestational diabetes that someone might not know about?
So gestational diabetes actually occurs within 10% of the pregnant women. And usually with gestational diabetes, there's no certain cause. So basically, you know, we have our placental sac that actually provides the nutrients to the baby, but it also affects the hormones of the mom. So it could block the insulin, or actually the mother isn't using the insulin that is correctly, that is produced to control the sugars. So her levels of glucose will actually be up. And at 16 weeks, the obstetrician will draw blood, and at that time, that's when most of them are actually being diagnosed with gestational diabetes.
Okay, and since we do talk about the gestational diabetes and pregnancy, one question is as soon as she delivers the baby, is gestational diabetes kind of over? And if not, is that affecting her ability to breastfeed?
So with gestational diabetes, it is a temporary condition. It is not a chronic illness. It usually lasts like right after pregnancy. In the hospital, the patients are not being tested anymore after they deliver. You know, checking their glucose and everything like that. When it comes to breastfeeding, if they had gestational diabetes, they can breastfeed. There's no issue with that. But one of the things that we do tend to worry about is about the baby, that because of the insulin levels that were blocked when the mom was pregnant, the sugar levels of the baby can drop after being delivered. So they're being monitored, and then they'll be, you know, given the glucose that they need.
All right. So, and since it kind of disappears as soon as she's delivered, then her milk is kind of going to take over with all the nutrients that might have been deficient during the pregnancy. Good. So one thing that we kind of get concerned about when we're talking about diabetes is who is actually going to treat for diabetes. Is that something that her OBGYN is going to begin treating, or will she need to see a specialist? Or
okay, so since we do get GDMs in our office, they're actually being referred by the doctor, by the obstetrician. So they're being referred to us, and also at times they're actually being referred to Driscoll, because they're the ones that will manage the baby also.
When a female is diagnosed with gestational diabetes, is this condition going to be managed through medication, or can we also manage it through food and exercise?
So when they are first diagnosed with GDM, they are referred to the nutritionist or to a clinic like us, where we can actually provide the meal plan. Okay, and then after a while, the doctor will see if they're doing it well, if it's being managed with the meal plan, or if not, then they are started with, usually insulin is the first choice. There is some medication sometimes that they do put them on, but the safest choice would be the insulin.
And that would be the injection when you say insulin?
Yes.
Okay, good.
Yes.
So let's say we have a female that is diabetic, diagnosed before her pregnancy. Is that going to impact breastfeeding for her and her baby?
It's going to depend on the treatment. So if they are usually diabetic before pregnancy, the doctor might switch them to the insulin injection for better control of the numbers. Or if not, they do have the option of using metformin or the glyburide to control the glucose numbers. And then also with the diabetes, you know, the breastfeeding. So if breastfeeding, it's actually recommended for patients that are diabetic, that are diabetic before pregnancy, because they'll get the sugars better controlled.
While they're breastfeeding?
Yes, while they're breastfeeding.
That is fascinating.
While they're breastfeeding, and it also, of course, helps with weight loss. So we just recommend that they exercise, you know, as much as they can tolerate.
Okay. So after they've deliver the baby and they're in the process of breastfeeding, do they continue on with your program for management?
It's going to be up to them. We do tell them, yes, come back like in 2 weeks or maybe a month. We give them at least a month to come back, because then we can give them a meal plan to help them with weight loss. But yes, if they're also breastfeeding, their calorie count does drop, but it won't drop as much.
Okay. All right.
But yeah, we do recommend they come back.
All right. And then is there any set time frame in which they like complete the program, or can they, or is the program available to them until they feel comfortable with their diet and exercise plans?
Yes, usually when they are diagnosed with the GDM, we do try to have them come back every month until they deliver. And then after delivery, yes, they have the option of continuing. We can see them at least every month or maybe every 3 months, because we do also have an A1C machine, hemoglobin A1C machine, in which we can check the sugars and we can see where they're at, if the sugars are controlled or uncontrolled.
Okay.
So that's free of charge.
Right. Oh, that's wonderful. And all of these counseling services and meal plans and exercise plans that you're talking about, all of that is free of charge?
Free of charge. They just need to call and make an appointment. And I did mention, like, we would get referrals, but we will take them also. They can call and we don't need a referral. All right. So they can be self-referral.
Oh, okay. Yeah, just like a call. Do you do walk-ins at all, or do they stop them and
well,
give them
they'll walk in and then they'll ask about the program, and we have to give them an appointment, because everybody's by appointment.
And now is that kind of because it's kind of a more in-depth kind of process? And okay.
The first visit is usually about an hour, because that's the one with the education and the meal planning.
Okay, that's really good.
So we do ask, like, they at least follow up 3 more times, total of 4. And then from there they can decide if they want to come back often or every 3 months.
All right, so that was really great information that you've provided us, and we'd like to thank Rosary Muñoz for coming down from Valley Regional Hospital. We also want to thank the City of Brownsville Maternal Child Health Division, which we're part of, and also the Breastfeeding for a Healthy Brownsville Coalition. So Rosary, is there anything else that you'd like to tell us, or possibly let us know how to get in contact with you?
Yeah, our contact number is 956-350-7338, and you can just go ahead and give us a call and we can make an appointment for you.
All right.
Thank you.